So, good morning, ladies and gentlemen. I followed my friend Maurice in welcoming you to that session. I'm Joël Rabot from Mauritius, and I represent my organization, which is Collectif Urgence tout Sida, well known as CUT, which is the first and the main organization working in harm reduction in Mauritius. And I will do my presentation on harmonizing public health and public safety in a politically conservative environment. So, to set the scene, I will talk about Mauritius and its socio-political environment regarding drug use, about the HIV epidemic in Mauritius. I will also talk about the public health approach, namely with the introduction of harm reduction strategies in our island. I will also show to you how is the current situation in Mauritius and what are the opportunities that we are having to harmonize public health and public safety on the other side. We will also talk about the key challenges that we are still facing and the way forward, better harmonization. So, Mauritius and its political environment, socio-political environment. Mauritius is a small island situated in the Indian Ocean. We form parts of the sub-Saharan African countries. We have about 1.2 million inhabitants with a surface area of about 2,000 kilometers square. Generally speaking, drug use is tackled with a very repressive approach. That is, we still have long prison sentences for drug-related offenses in our island. And on the other side, the general population is still conservative about drug use, still using the say no to drugs approach, which on the other side puts people who use drugs, stigmatize and discriminate them. Politicians being what they are, politicians in Mauritius usually use a populist tough on drugs approach. I can take the example of the last election where politicians pushed the death penalty during the last election. So, what about the HIV epidemic in our island? Mauritius has a concentrated epidemic with a prevalence of 1.02 in the general population. The first detected cases of HIV was known in 1987 until the end of March 2014. We have about 5,800 cases detected, with 70.5 of the new cases related to injecting drug use. And according to the last IBBS, the last integrated biological and behavioral surveillance study done in 2011, we can see that we have an estimated number of 10,000 people who inject drugs in Mauritius. So this graph shows the HIV prevalence rate among key affected populations, and as you can see, the rate in people who inject drugs is higher among all other scabs, that is, men having sex with men and female sex workers. So, public health approach, I will talk about the introduction of harm reduction strategies in our island. So, to go forward toward this, I will talk a little bit about the history of harm reduction strategies introduction in our island, namely through civil society, who in 1996 started to raise the alarm about HIV among people who inject drugs. This was shown that they were on the right side with an exponential growth of HIV infection within the population in the early 2000s. The graph that follows shows clearly the situation during the year 2000 to 2005, where the HIV incidence in people who inject drugs in 2000 was about 2%. And it rose till 92% afterwards in 2005. So to continue with the history of harm reduction strategies, 2004, Mauritius social workers and NGOs working in drug use and in HIV started to advocate for harm reduction, and thus we create the Collectif Urgence Toxida, CUT. In 2006, we launched illegally the needle exchange program. There was no legal framework. And afterwards, the Ministry of Health followed with methadone substitution therapy. 1 year afterwards, we obtained our legal framework through the HIV and AIDS Act, and CUT was invited to sit on the National Needle and Syringe Program Committee so as to help the government in launching theirs. 2009, CUT opened its premises and started the follow-up of needle and exchange program in the country, and also followed the advocacy on harm reduction. 2010, Global Fund we have a global fund in our island, and this allows us to upscale all our harm reduction services. And in 2011, the methadone substitution therapy was introduced in prisons. This is especially to show you how advocacy from civil society has helped us in putting forward harm reduction strategies in the island. And what are the results? I will show you afterwards. So nowadays we have needle exchange program and methadone substitution therapy in our island. We have about 40 NSP sites all over the island working in different models, fixed site, mobile and backpack, and we have about 2,500 people who inject drugs who are registered on the program. On the other hand, the methadone substitution therapy, we have about 6,000 people who are registered, and methadone has been introduced in prison, as I was telling you in the last slide. So what is the result? What is the current situation in our island? As you can see, now the incidence rate has gone down since 2005. We have, it can be clearly shown that through harm reduction strategies, we have been able to decrease the HIV incidence rate among the people who inject drugs population. On the other hand, statistics from police can show that there is also a decrease in crime rates for drug-related offenses, going from 2,000 cases in 2007 to about 1,000 cases in 2012. So what are the opportunities that we have had to harmonize on one hand public health and on the other hand public safety? First of all, we have obtained our legal framework, which is now available for needle and syringe program. It was inexistent. We have advocated for it and obtained it. We have nowadays, harm reduction is now present in national strategies, in our national strategic framework for HIV/AIDS, and it is also supported by the Global Fund. We have our national coordinating body, that is the National AIDS Secretariat of our island, who has created an enabling environment for harm reduction. We have the implication of the public sector, who is now helping us in advocating for a drug control master plan, which is inexistent in our island. So we have the private sector, which is helping us for that. We have a chance to have policy dialogue between government and NGOs, even if at some point in time it is very difficult to push our strategies. We have the availability of data through recent research, which now help us to make it very clear about what is harm reduction, what we are doing, and for police enforcement, how they can use data that are available to know about CAPs, about key affected populations. And we have, with the help of ADVOCACY and other experts in harm reduction, undertake the training of police force and legislators in our island. So we still have, till we have some key challenges. First of all, as I was telling you, we have no national drug control master plan since 2009. The last plan was done for the year 2004 till 2009, and this one focused mainly on supply reduction and demand reduction, with a little component, very little component on harm reduction. We still have clashes between the repressive approach of the system on one hand and public health approach. That is, for example, we are providing clean needles to people who inject drugs, and on the other hand, the system is still harassing and arresting those persons for syringe possessions. We still have a repressive approach, that is the behavior of key affected population are still criminalized, which then put them to become vulnerable. People who inject drugs, commercial sex workers, or even men having sex with men are put into jail and afterwards don't have access to services, to appropriate services. And the level of stigma towards key affected population is very, very high. People who inject drugs, for example, are still harassed. The last IBBS shows us clearly how they have public verbal assault, and they are being already harassed, always harassed, even at service delivery. So what is the way towards better harmonization? First of all, we have to strengthen our advocacy towards media, partners, users, community, government, police, even corporate social responsibilities of private sectors. We think that we have to advocate for a national drug control master plan based on the 4 pillars, that is on harm reduction, prevention, law enforcement, and treatment. And that should include legal reviews, drug policy reforms, recognition of harm reduction approaches in strategic plans of law enforcement. We also need to advocate for the ongoing training of police and even other partners, and the inclusion of harm reduction module in the police force curricula. I think we will have to learn from our friends of Kenya and Ghana about this. And we also need to do research for advocacy. That is, we need better research so as we can have evidence-based data for advocacy towards policymakers. And we have to strengthen also the policy dialogue. We have a possibility to do policy dialogue, but we need to promote representation of key affected population on platform that can enable more harmonization, and on the other hand, the better implication and representation of civil society in committees such as the CCM or the Harm Reduction Committee, National Harm Reduction Committee. To conclude, I will say that Mauritius has achieved a lot in terms of initiatives in introduction of harm reduction. But if we want to achieve more in terms of better, effective programs where key affected population human rights are being respected, we need to do strong advocacy toward the changes and in terms of law enforcement and reforms. I think that this platform gives me the occasion to share, but also to learn from best practices, and also to make a call for the global community to help us in working towards the changes of law enforcement in our island. Thank you for your attention.